Friday, February 5th is National Wear Red Day. Janine Lassand has more details with the Director of Cardiac Services for Lehigh Valley Hospital Hazleton, Barbara Hunsinger.
So I'm here today to actually let everyone be aware of, what are you going to do on February 5th to celebrate Go Red Day? And what does that mean? So women and heart disease is a big topic. And, we all understand in the medical field how important heart disease is. And I think a lot of us don't realize for women in heart disease, it is very, very important. So if I look at some of the statistics, Janine, I see that cardiovascular disease is the #1 killer of women, causing 1 in 3 deaths a year. And that's just one too many. So if we can get out to the community and to our families and to everyone, the importance of cardiac disease, especially in women, Go Red Day is what we're trying to celebrate.
How did the Wear Red for Women begin?
Going way back into the 80s, and they realized the importance of cardiovascular disease in women. And they decided to start this and to have this day every year. And they thought red, hearts, love, take care of yourself. And this is where it all came from. So basically, they want us to know the heart truth and celebrating Heart Month so that everyone is aware, because heart disease has always been up there as a #1 killer.
Now, is it a certain age that should be more cautious than others for women?
I would say no. I think that this is something that we need to know from when you're very young. We know that there could be heart disease. There's congenital heart disease. So everyone needs to be aware that can happen at any time in our lifetime. And it is so important that we embrace it. And especially as we start to get a little bit older, that we realize that importance.
What are the symptoms?
The symptoms of heart disease. So they can vary. So especially, when we think about someone having chest pain is probably your primary symptom that some people have. However, in women, sometimes we don't have typical chest pain across our chest or in the middle of our chest. Sometimes we have something very subtle. We can have pain in our jaw. We can have arm pain. So basically, this is something that is new. Comes on all of a sudden, usually, and we notice that it is something different. So my advice would be is if you don't feel well and if something is not going away, make sure that you get some professional help, and do never be afraid to call 911 if you need to, if you think that this is serious.
Can this be brought on by stress?
Stress, absolutely. So stress is one of the main issues that we are trying to control. So how do we prevent it? Managing stress, especially today, as with all the COVID crisis, I think it's extremely important to realize we need some outlets, Janine. So, basically what I'm telling everyone is, get outside, even if it's cold outside, do some walking, do some hiking, put some music on in your house and dance a little bit, do something to manage your stress. And I think most of us are aware of what works for you, and make sure you follow through with it. Exercise if you can, even if not in a formal program at this time. Do something that will help you to manage how you feel.
From the information that you sent me, nearly 80% of cardiac events can be prevented. So again, talking about it, wearing red as the awareness, to spread the awareness is key. You mentioned working through the pandemic, working through COVID. What are the challenges that are facing women, especially in the healthcare field, through COVID?
Well, I think that if you're looking at it, you're looking at your healthcare providers, especially. I think there's so much stress among our first responders. I think as far as our hospital staff, I'm in the outpatient side here. We are still, we are rearranging what we do on a daily basis. We are keeping everything as clean as possible. We are so much encouraging everyone, wear those masks, wash your hands. We're wiping down everything in between patients. So that patients, if you need to have something done, that's another stress area. Don't be afraid to go out there, see your primary care doctor, see your cardiologist, keep your appointments, have your testing done, because I would not be afraid to bring anyone in my family here, either to the hospital or to the Health and Wellness Center if they needed anything done.
Very good. Again, wearing red on February 5th in awareness of cardiovascular disease, and I think you hit the nail on the head when you mentioned keeping your appointments, right? Keeping our doctor's appointments, keeping our health visits, and doing what we need to stay healthy. Barbara, thanks for joining us again from Lehigh Valley Health Network in Hazelton. Thank you so much.
You're welcome.
Today's news feature is brought to you by The Cheese Store and more. Go to their Facebook page to see their specials and check out their catering menu.